As medical director for Hamilton County Public Health, Stephen Fagans has had plenty of conversations with his colleagues about COVID-19 vaccines.
We actually don't think anything has really changed. You know, the folks who are very much needing or wanting for medical reasons a vaccine still qualify and will still get it. The individuals who didn't want to get the vaccine for whatever reason before will probably not get it.
Fagan says those who want protection from COVID need to know that the FDA has announced people 65 and older now qualify for a shot. So do younger people with certain qualifying conditions.
Under age 65, it's more related to risk factors. And so if you look at the CDC risk factors, they're pretty generous. In fact, at least 3 out of 4 Americans would qualify just out of hand.
People who don't qualify should still be able to get a COVID vaccine, but there may be some uncertainty surrounding who pays for the shot and how much.
Obviously, that is something that has become very fluid. And I think most payers are looking at kind of individual state and group recommendations to decide coverage.
Dr. Fagans does not foresee insurance coverage being a big problem.
You know, the vaccine could be about $200 or so. It appears that most insurances are going to pay for the vaccine as they always have. It's in their best interest. And so when you get a vaccine, you're less likely to miss work. You're less likely to go see the doctor or have to be in the hospital. And so as far as we know, the insurances are kind of the same.
Now, members of a CDC vaccine advisory panel, often referred to as ACIP, will meet soon in Atlanta to discuss and to review data about a host of vaccines, including the COVID-19 shot. That meeting is in a little more than 2 weeks' time, right around the time that respiratory illnesses really do start to float through the air here and across the country. Now reporting live tonight, Todd Dykes, WLWT News 5.